This is actually kind of a wild story. When I was in college, I did my internship out in Philadelphia. I lived smack downtown, and it was the best experience. Instead of doing a summer internship, I decided to do it from September to December, and that got me all four sports out there in Philadelphia. I got to go to football games, baseball games, basketball, hockey. I'd already had a football team that I liked, a baseball team that I liked, but I was still somewhat of a free agent, I guess, when it came to basketball. And so this is during the kind of trust the process years. They had just drafted Markel Fultz as kind of their as one of their top players, and I was down at games all the time and just became a massive 76ers fan. So over the next like few years, I just kind of followed the team, and we'd moved to Dallas in 21, and the Sixers got to play Dallas down here just one time. And so my wife and I, we got tickets, great tickets, like 5 rows up for the game. And there's a tornado that happened during the game, right in between us and the stadium. So we couldn't actually go down. But then come second half, we looked at the weather. The tornado had already passed. And we're just like, we look at each other like, should we go for the second half of the game? So we jump in the car and we're driving down, and I kid you not, there's like 8 or 9, like 16 wheelers that are flipped over on the highway because this tornado had just come ripped through and flipped them all over. And magically, we pull up, it's about an hour away. We pull up to the American Airlines Center here in Dallas. And the one free parking spot that's available in front of the stadium was open. And so we park there, run into the game. There's 8 minutes left in the fourth quarter. So we drive an hour down to go through this whole thing, watch the 76ers lose, but we were actually right in the seats, right next to the tunnel where the 76ers players were leaving. And I was wearing this jersey that's behind me right here. And Tyrese Maxey, whose jersey it is, walked through the tunnel. And I yelled down to him and asked if he'd sign my jersey. And he said yes. So I took my jersey off and threw it down to him. He signed it for me and tossed it back up. So that is the wild story of the jersey that's sitting behind me right there.
Guys, I am here with Chris White. Chris, I'm really excited to have you on today. Thank you for coming on. And I want to start by just sharing with everybody who's listening what solution it is that you offer to your clients, because we're not here to talk about sales. We're not here to talk about quotas or anything like that. We want to talk about the actual reps who are out there providing solutions to their clients. And I know that's you from the time we've known each other over the last couple of months. You're just like very clearly offering solutions and blowing my mind, by the way, when you tell me some of the stuff that goes on in your industry. So anyway, welcome, Chris. And could you just give us like a quick run through about what solution you offer the market?
Yeah, no, I'm super excited to be here because what we're doing is just incredibly important. I think that everyone knows that the healthcare system, particularly in America, needs to be fixed in one way or another. And the one thing that we can't really agree on in this country is how we're going to fix that. So there's solutions left and right trying to solve this issue. And I'm just really excited to be on the forefront of what I think is helping with that. Uh, so much of our issue in healthcare comes from the fact that we are in a fee for service model where these large insurance companies and these large hospitals and healthcare providers are only getting compensated when large costly events happen. So whether it's a knee replacement or a hip replacement, if someone has cancer and has to go on chemotherapy, if you get COVID and you have to go on a ventilator, all of these events are compensating hospitals and insurance disproportionately to the value that it's actually bringing individuals who are trying to navigate this healthcare experience on their own. So the point solution space within employee benefits has been a spot where groups like us at Reperio and others are trying to solve some of these issues to make healthcare easier, more accessible, and just work better for people. So employers are going to offer their employees various benefits, including health insurance, dental, vision. You might see some other ancillary solutions in there, like a life lock, like some life insurance. Maybe they'll offer a match on contributions to your HSA or 401k. But then there's going to be other options that are added into there. That's where the point solution space comes in. I've worked in point solutions for the past 6 years. Started off at Sword Health, where we were providing digital physical therapy services to large employers. Made the move later over to Noom, where we were doing uh, weight and diabetes management as well as mental health. And now I've made the move over to Reperio Health, where we are really taking a preventive and proactive approach to healthcare. One of the main things that's driving these large events that are making hospitals and insurance so much money and are making us sicker and sicker are the fact that the system that's here is just getting us less and less healthy. You don't have to you don't have to be a rocket scientist to walk down the street and realize that people today look, sound, and feel a lot different than people did 10, 15, 20 years ago. Cholesterol, diabetes, obesity, chronic conditions are running rampant, and we're not making it easy enough for people to get even access to the simple data that's going to help them know what life decisions they need to be making in order to get themselves that little bit healthier, or to make the difference that they need to avoid a lot of those high cost, timely, annoying issues that so many people face. And so that's where Reperio really is coming into play. Is we are helping make preventive care a lot easier by bringing like an Amazon like approach to getting a full preventive health screening. So super excited to talk a little bit more about what that all looks like.
Nice. So people are able to get these preventative screenings done in their home such that they actually do them, which is helping people catch things before they wind up paying tens or hundreds of thousands of dollars in healthcare costs, which is then saving the employer from having to pay that on the self-funded insurance program. Is that what I'm hearing?
It's exactly right. We're helping people to get the information that they need about their own health. So, is their blood pressure an issue? Is cholesterol an issue? Is obesity an issue? Maybe you don't need a Reperio Health screening to realize that might be an issue, but sometimes you might. But really, what we're doing is we are bringing some of these health metrics to the forefront for people so that they can make the changes in their life that are going to be meaningful and avoid those high cost claims later. So not only is it saving the employer a lot of money, but it's also just helping the end person be healthier, which is really what the focus needs to be on. We need to create healthier people in our workforces and, more importantly, across the country, or else we're just going to continue down this profit rabbit hole where we get unhealthier and they keep making tons and tons of money off of us.
So the HR leaders and the benefits leaders that you're talking to, they obviously would know about preventative healthcare. They would probably like it because they probably understand that it helps to save them money in the long run. What is the biggest issue with current solutions? Like, why aren't they already doing something that works?
Most are actually. So most companies are doing something along the side of preventive healthcare. A lot of the things that they're doing are either like an on-site biometric screening, or they're incentivizing their employees to go into their primary care doctor's office, or they're just trying to do like another maybe steps challenge or other wellness initiative to just generally improve the health of the population. The issue with so many of those options that are out there is that they're cumbersome. The on-site screenings are getting maybe 5 to 15% of the population engaging in it, because you've got to take time off of work. You've got to go down. You're in front of all of your coworkers and whatnot. you've got a doctor asking you some kind of personal questions about your health and your life, and you don't know who's overhearing what you're talking about and whatnot. And so it's just an uncomfortable experience. And then if you're gonna go into like a quest to get lab work done or go into your primary care doctor, you're taking time off of work, you're taking time away from your family, you're having to commute to the office and back, sit in the waiting room for who knows how long. And that's even if you can get an appointment. A lot of times, if you try and get an appointment with your primary care doctor, you're waiting a month and a half to even see them in the first place. So there's just so many friction points that we have essentially eliminated completely to where you can get on your phone and opt into a program. We ship the kit to your home, and in under 30 minutes, you have your entire screening done. The results are instantly on your phone, and then you put the kit back outside your door. UPS comes and picks it up, and you're done. You never have to leave your house once. So that's why what we're doing is so effective. Is people are actually using it, and we're finding that groups who are bringing us on, typically for other preventive health solutions, they've seen 10 to maybe 20% of their population participating. We're seeing north of 60% of employee populations are participating in this because it is so easy and seamless, and we're removing all those friction points for them.
Dang, dude. So you just said like that's a 3 to 6x increase in uptake. What kind of results is this giving to employers? I'm talking about like number one, how much money is it saving them in like long-term health? And I mean, obviously the numbers, I don't know how long you guys have been in business, but the numbers are just going to go up 10, 15, 20 years from now because you're going to be saving all this stuff, not only now that people need, but long-term as well. So talk to me about savings, talk to me about ROI, talk to me about like what results this is bringing to the people in the community.
Yeah, it's really interesting because you would think that just surfacing these numbers, you don't know what type of difference it's actually going to make in their population. What we're finding is that for every dollar that they're spending on Reperio, we're actually saving $4 to $8 in claims that we can avoid due to surfacing on them. Uh, a couple interesting angles that we've looked at with this are number one, the diabetes, cholesterol, heart issues, and those types of associated claims. But if we can help someone get ahead of their own weight and personal health, and we can help someone choose not to take a GLP-1 drug, for example, like Ozempic or Wegovy, just that decision alone saves an employer $12,000 a year per person. And we don't know what type of increased in cost over the long term that person uh, will have brought on with the employer, whether they are covering that drug or not for them. Uh, the other issue as well is called metabolic syndrome. Metabolic syndrome is there's a list of 5 biomarkers that are measured there. And if you're out of range in 3 or more of those biomarkers, you are considered to be positive for metabolic syndrome. And those who are considered positive with metabolic syndrome see massive increases in chances of heart attack, in all cause mortality, and in diabetes in the future. And so we are just helping to bring all of that to the surface and provide people really with the data that they need to be able to make the changes that they need to.
Amazing.
Actually, on my calls, I focus so little on ROI. So many solutions out there try and tout an ROI and try and show very softly and loosely how their solutions are saving them money in the long term. But oftentimes they really don't actually translate into hard savings that the employer can calculate and realize. And so When employers hear ROI, I feel like their eyes glaze over and you lose all attention there. But when you talk about the value of the investment and the message that that investment is sending to employees is far more important. The value and message being, we care about you and your health. We want you to be healthy and we want you to be armed with the data and information that you need to be able to make a difference in your own life, not just cut costs on our side. If it's profit driven, then the results aren't always what you want them to be. But if the focus is really on how do we make people healthier and sending that message effectively to their population, that's where some magic starts to happen.
So, what is the person that you're talking to in a company, whether that's an HR leader or a benefits leader, what are they thinking when they're coming to you? Is this like, a culture thing? Is it just an ROI thing? You just talked a little bit about that, but talk a little bit more about like what does putting Reperio into like the stack of benefits or HR, what does that look like for a business? What are those feelings that the company gets, that the people in the company get? Because obviously the people are the culture, are the company in a very real sense. What kind of feeling does this bring up to them when they're like, oh, we've got Reperio. It's as easy as doing this in your pajamas at home. Like, just don't worry about that. We love you. We've got this covered. Like, what does that do to a workplace?
No, these are all fantastic questions. When I have conversations with benefits leaders, primarily the reason that they're even having the conversation with me in the first place is because they've tried over the years to incorporate preventive health into their whole ecosystem that they're building for their employees. And so often, every single step that they've taken trying to incorporate preventive health in has been met with lackluster participation and not enough meaningful results to actually drive the change that justify the expenditure of it. What it does for a workforce is really cool because partnering with Reperio means that not only are they not afraid to be on the cutting edge of technology and options that are out there for employees, but it shows, number one, that the employer cares about your health. They care about you being empowered with the data that you need to make your own health decisions and to do so wisely. Number two, it shows that they care about your time. They're not going to ask you to do something that's going to take hours out of your day that, frankly, most of us don't have anymore. We are all so busy in this crazy world that to respect someone's time enough to offer a solution like Reperio to show them, hey, we care about your health, but we don't want it to take more than 30 minutes of your time in your life, and then you're done, goes a lot longer way than a lot of people consider maybe before we have those conversations. But it ends up being really impactful to employees moving forward.
Is there a conversation to be had at all about what happens after the screening? Like, do you guys work to integrate solutions? I'm curious. Is that where it ends? Just like the scan, or where do you guys go from there?
Super great question. So it goes into so many different directions. Right now, with just the kit, so when someone completes our preventive health screening, they're going to get their results right there on their phone. And they can, let's just say that they have low HDL cholesterol. They can click into HDL and read about what is HDL, why is it important. I thought high cholesterol was bad, but now it's telling me low HDL is bad. It goes into those details, and then it gives you realistic ways that you can intervene with that poor reading. So whether it's a lifestyle change and things that you can do with your activity and your food, but also if you want to take a pharmaceutical route to improving those levels, it gives you those tips too. What Reperio is working on now, and we are about to go live with actually, is a solution called Reperio Care. Reperio Care, what will happen is you'll go through the same kit experience where you get all of the results instantly onto your phone that no one else can do, by the way. And then immediately after those results are complete, you have a telehealth visit with one of our licensed clinicians who will be able to go through not only your results as far as a snapshot of where you're at today, but we'll also be able to pull your 10-year health history so we can see what procedures have you had done before? What issues might you be already be dealing with? And I'll pull that into the context of the conversation. So instead of it being a peppering of 5 minutes of back and forth, well, tell me about your health history. What have you had done before? Right off the bat, it's an immediate value adding conversation where you're putting together an action plan with a clinician who knows your health, who knows your readings, and can help you take the steps to getting healthier in a really meaningful way. Uh, so that's one of the primary ways that we're kind of solving that issue from here. Because the other main issue is just it comes down to the continuity of care, right? So you get the results now. So what? Well, now we can pair you with a physician and a clinician who can create that action plan for you, give you the steps that you need to take, and even be able to write you a prescription if you need to. And sometimes, honestly, Kurt, what they'll do is they'll say, you need to go to a doctor in a brick and mortar center now because your readings are so out of whack that you need to get this looked at or else it could be imminently dangerous for you.
That's huge. Man. Okay, let me shift gears just a little bit because I want to ask you. You told me, or your LinkedIn told me, that you're a finance nerd and a fitness junkie. And I think that's a really interesting combo in your space. And I'm curious how it shapes your approach to solving healthcare challenges, talking to your clients, and just being in this space in general.
Yeah, no, I'm so super happy you asked that because I can talk your ear off about all things fitness, health, biohacking, finance as well. So a lot of people don't know. I actually started my career off as a stockbroker at a large stock brokerage here in the U.S. And I grew up right outside of New York City, and all of my friends' parents were Wall Streeters that had big mansions, drove really fast cars, and I saw that and I said, man, whatever that is, I want it. So I go to school and I study financial economics, come out and become a stockbroker, and I do well with my own portfolio. I love learning about the markets and trading and investing. But the experience of working in finance just wasn't a good fit for me. It just wasn't where I could see myself long term. Uh, so I made the shift over and got actually recruited into Sword Health, which is back in this point solution space for employee benefits groups. And that really opened my eyes, not only just to this industry, but to health and optimization in general for myself. So I've started going down all the rabbit holes of Andrew Huberman and Greenfield and Asprey and Atia and all the guys. And there's so much to learn about how our body works and why the systems that are in place right now are only making us sicker unless we are just extremely intentional about what we are doing with everything that we put into our body, with every movement we make. It's exhausting. And then you have a job where you are told to sit in a chair and look at a screen for 8 hours a day, and still you look at Instagram and you look at that guy with a six pack and you say, I want that. Uh, that's really difficult to do when you're sitting around a computer screen. Uh, but what you'll find me doing is in any little bit of free time that I have, if I'm not with my beautiful wife or my two young boys, uh, I'm listening to podcasts about the latest and greatest in health and personal training. I'm at the gym. uh, I'm a nerd when it comes to processed foods as well. I try and eat pretty much only whole foods. I try and get all like the additives and dyes and preservatives out of my life as much as possible. And I don't necessarily tell people that they have to do the same as well. But if you're ever interested and you ask me, you better be ready for a long conversation because I will talk your ear off. I promise you.
Dude, we are so similar like that. We are just like whole food 99% of the time. And yeah, it's so important. And you better, be living that lifestyle in preventative health. I tell you that. So, Chris, when we first started talking, you told me something that literally blew my mind. And I am still reeling because I had no idea. But you told me that there are people in the United States who are leaving companies because some companies don't pay in their insurance plans for GLP-1s like Ozempic. They're leaving to go to companies that do. And for me, as a guy who, totally relates to your sort of health kick and what you were just saying, I am floored that this is such a cultural thing. And I'm curious, like in the space that you're in, tell me about GLP-1s and like the whole landscape. What's going on here?
Yeah, no, I'm so glad you asked that. It's been such a hot topic issue for years now. And I'll start off by saying one thing. America does not have an obesity problem because of lack of access to GLP-1 drugs. Now, that being said, uh, it's been a topic of conversation of whether those should be covered by employer health insurance plans. Because going back to the fact that a lot of large employers are self funded, they're the ones footing the bill for anything that insurance would be covering for each employee. So it's just really important to remember in this. So we're not pointing our finger at insurance companies. This is an employer by employer decision. Right now, more than half of large employers are actually choosing to cover GLP-1s for their employees. And what we're finding is that employers who aren't are seeing an exodus of employees who are leaving their current job to go find another company that is actually paying for and offering GLP-1s. Because if you're making, Kurt, if you're making $40,000 to $60,000 a year, you don't have $12,000 to shell out to pay for Ozempic or Wegovy out of pocket, right? And so you have this group of people who are going to want to use this. And I'm not saying that GLP-1s don't have a place for a subset of people. But what I am saying is that the issue is not you have 5 pounds to lose. Let's just take a few quick hits of Ozempic. The issue is it's really expensive. Employers don't know whether or not they should cover it. And if they do choose to cover it, will incurring that large additional cost actually save them money or cost them more money in the long term? And what we're finding is with how many people are jumping on and then jumping off of these drugs, as well as the other external detriments, I guess, to it when it comes to muscle loss and some of the other side effects that are coming along with it, is it's actually in the long term costing employers more money on the healthcare side of it. So they just have to weigh out, do I want to cover this? And then do I want to put up with the recruiting nightmare of having to replace more people? Particularly, oftentimes the people who are leaving are the ones who are in like the 50 to 60 age range, who might be in the more senior positions, the harder positions to backfill. So there's a ton of nuance to what's going on here. What I do know is that GLP-1s are here to stay, no matter what. It's the sad truth of it. But that's why solutions like Reperio are here, is if we can help arm people with their health data ahead of time, maybe they can make those lifestyle changes first before they jump directly to a pharmaceutical option, which is what I really hope that people are able to do.
That's fascinating. I'm learning so much about GLP-1s and all that kind of stuff. And I see that there's a space, and employers have this really difficult decision to make, essentially. But I also wonder, speaking of sort of magic wands for weight, what is your magic wand, Chris? What is your magic wand? If you could wave a magic wand and fix preventative healthcare for self-funded employers, what would that magic wand be?
If I had a magic wand that could go into self-funded employers and fix preventive healthcare for them, you'd have to mimic what people are doing right now. And right now, we're in a world where everything is instant gratification. If you ask someone to go out of their way, the likelihood of them actually doing it is so incredibly low. We're in an Amazon time. You can sit on the toilet and pull up Instagram reels and be influenced by so many different options in front of you. And so we take all the friction points away from self-funded employers is essentially what I would do with my wand. Is I'd make it as easy as possible for employees to participate in and get as comprehensive results as possible from whatever it may be. And that's why Reperio is doing what we're doing. That's why we're trying to take away as many friction points as possible and give you as much data as you can with instant results. If you have to send in a blood sample to get your cholesterol back, you're probably not going to do it. But if you can get it right there instantly on your phone, you're going to see a lot higher participation. And that's what we've seen with employers that we've worked with so far.
Okay, so this makes sense to me. I'm obviously all about preventative as well. I agree with a lot of stuff you said earlier about, all that kind of stuff. And I also agree, as much as I hate to admit it, I likely only do things when they're right in front of me. It's so hard, man. So I hear that. But I'm really curious, actually, like in terms of who you work with, who are you seeing this really benefit? Are there any cases? Because I know like big companies, big headcounts, great idea for HR and all the rest of that kind of stuff. But is there any use cases that I'm maybe not thinking about that are actually really beneficial?
Yeah, no, I'm super glad you asked that because Reperio really is a great fit for, number one, any company who is putting an emphasis on preventive employee health. But then number two, one thing that's become very apparent to me, I've talked to several groups who are growing their companies very rapidly, including a group who is planning on doubling their headcount between now, as we're filming this in September, to the end of the year. And what's happening is increasing your headcount so quickly and so rapidly, you are now inheriting all of the pre-existing conditions, all of the healthcare risk associated with those individuals. And that could be the fact that you're making your employee population healthier, or it could be the other direction. What Reperio is doing for employers is helping them to very easily get ahead of that and allow those new employees to get screened so that the employer can get an aggregated data set and see how the trend of their employee population is moving with this new additional headcount coming in. This is really important when it comes to the conversations they have with their broker as they come on renewals, when how they design their health plan with deductibles, out-of-pocket maxes, premiums, and how that's going to look, as well as wellness initiatives. If you don't know the health status of your employees, how do you know that yet another steps challenge is the right thing to do versus something more targeted and driven by actual data? And that's the type of data that we're providing to employers, is enough that's empowering them to make more tactical decisions on their employee health strategies, really.
Got it. Okay, so I think I was ignorant of the fact that the employers got all this data in aggregate. And I think that's a huge benefit for the sounds of it. Is there anything else that you've seen that lead to? It sounds like obviously they can make better decisions. Is there anything else to talk about with that?
Yeah, I'm actually really excited about a couple groups that we're working with whose employee populations are actually significantly healthier than the average group of Americans that you would just pull off of the street. And when it comes to health insurance is going to base their premiums off of who they assume and how healthy they assume your employee population is. But if you can come to them with data and show we are actually healthier than you assume that we are, that employer is now empowered to go to the insurance and bargain a better rate because they are a less risky group for them to work with and can justify paying lower premiums. And if their current insurance company doesn't offer them lower premiums, guess what? There's tens and dozens of other insurance companies who would love their business and would probably offer them a better rate in return. So it just gives that bargaining power and puts it back into the hands of the employer rather than just based off of a pooled group of anonymous, faceless people.
That's so smart, man. And I really appreciate you diving into that. I'm curious to talk a little bit about how you work, what the process is when you are talking to a benefits leader or something like that. I just get the sense, like we've talked a number of times now, I'm like, Chris is not showing up being like, why my thing? So I'm curious, like what your pipeline is like. How do you deal with the people you're working for? Because it seems to me like much more solution partner oriented. Am I getting that wrong? Or how do you fit in then to being a partner to the people you're working with?
Well, Kurt, don't get me wrong. I would love if people buy my thing, but it's not because I ask them to. Uh, Really, the approach that I take is I'm never going to try and sell something to you that I don't feel like is going to be a good fit. And I want to understand as much about you, your employee population, the situation that you're in, what you've tried before, as well as like what are your actual goals within your role and who you're answering up to that are going to make this decision make sense. And then essentially what I try to do is I try and understand it well enough to determine number one, if I feel like Reperio is actually a fit for what they're doing or not. Believe it or not, I've actually turned away people in initial phone calls because it just didn't seem like our incentives were going to align enough to make it make sense for us each to devote the time and energy into the continuing conversation that it would take to get a deal through legal and red lines and the evaluation process and whatnot. Uh, I don't want this to be a disservice to anyone that we're working with. So I really try and focus on what's going to move the ball for them. And my role really, instead of selling the product, is reframing or helping them reframe the way that they're looking at the current pains and issues that their organization is facing and how using something like Reperio is going to be a more effective way to go about it than they may have already previously considered.
Got it. Okay, that makes a lot of sense. So it sounds like you're, again, which I assumed, and I'm glad to hear that it's proven true because, man, you're just, you're really easy to get along with and you seem like you really care. But I'm curious then when it comes to your pipeline and stuff like that, like what has been your process coming into the sales world? Talk to me about finding leads. Like, are you cold calling? Are you doing other stuff? Like, what does that look like for you and how did you sort of develop your skill set along the way? Let's just dive into the weeds a little bit for fun.
Yeah, no, I'm super glad you asked that as well. In March of 2020, it was peak COVID time, is when I started my career in digital health and particularly in sales. I was thrown into a business development role where my job was to just generate leads, to get as many interested people as possible to agree to a meeting that I can then hand over to one of our regional VPs to come in and run that in their pipeline. Being COVID was a very interesting time to get into sales, particularly in B2B, uh, because people just were generally unresponsive. What happened was is you didn't even know if you were going to be alive the next week, never mind have the bandwidth to evaluate a new technology to offer to your employees. So it was a crazy time to get in there, but I realized very quickly that I was not going to have and get the experience I needed just through pure volume and being able to call a bunch of people and refine my skills. And so I had to find ways to refine my skills internally so that when I did have an at bat, that I had as good of a chance as I could to convert them into a deal. And so I was selling into employee benefits groups and HR just like I am now. And I immersed myself in the HR world. I became Toby from The Office. So, I joined every single LinkedIn human resources and benefits and wellness page. I joined all of the email newsletters. I was getting onto Instagram and Facebook and Reddit and joining the different meme pages. I wanted to see even what they were laughing about, what jokes they were sending to each other, so that I can be as deeply ingrained into their head as possible. And that way I can relate to them. When I think about people who have sold to me effectively before in the past, it was never because they articulated the features of what they're doing well to me. I related actually always my approach to if you're going out to buy a car at a used car lot, and there's two different types of salesmen. There's the one who grabs you by the arm and says, "Come take a look at this Camaro. It's got 600 horsepower. It's got a convertible top. This is going to be fantastic. You're a single man. You want to drive fast. I know it." And then there's the one who actually takes the time to ask you questions about yourself, to understand what it is that you're actually looking for in a car, why you're there today, and can bring you something that you're actually looking for. And the best ones are the ones who are able to say, "Hey, you said that you're looking for this car specifically, but based off of how you answer the questions, I actually think you might be a better fit in a car like this because of X, Y, and Z." And that's where the features come in to make a difference, to reframe the way that I was thinking about things. And so when I was looking into sales and how to reach and talk to human resources professionals, I would try and think of it in the lens of what questions can I ask them that are going to boil to the surface pain points that I know that they're going to be likely experiencing. And then how are you dealing with those pain points today? And that's when I can come in and say, "Hey, this is why a lot of employers are choosing to go with a product like ours, because they were doing it this way before, and instead of doing it the way that we're helping you do it is affecting you in A, B, and C ways, leading to X, Y, and Z results." And that's what gets meetings. And so I turned myself into a cold calling machine. I had gotten to the point where the industry average, if you connect on a cold call with a potential buyer, is about 5 to 10% of cold call connects are going to turn into a meaningful meeting. I was converting 37% of my cold call connects to discovery calls. And over the course of my 2 years at Sword, my efforts led to over $20 million in annual recurring revenue for the company. And so I realized that I had a knack for this, and I built a skill set that had made me invaluable to groups who are looking to sell similar types of products to this very specific set of buyers.
Dude, that's insane. That is so cool. And I love, like, it makes so much sense though, to take the time to go see where they hang out, what they're laughing about, what like the water cooler talk is essentially. But it's in memes now, which is hilarious. But to be able to like talk to people like that, it's reminding me actually to do the same thing, to see what my people are struggling with, to like have those conversations with them and to just like relate to them. Because I think we all focus on ourselves so much, or maybe I'm unique in that, but I don't think so. It can be hard to get out of our own heads and actually go talk to people who we're supposed to serve. And it all comes down to serving too. And actually, I totally didn't plan to say this. So this is just like, this is completely what it needs to be. Speaking of service, speaking of
Yes.
serving, your life is not all about sales and health as much as, we've just talked about that a lot. You got a lot of other stuff going on. You've got kids, you got on mission trips, you work like every morning, I think you said, with the young people in your community. Like, tell me about the things that you're doing to give back to people, to just like pour into people as that service element.
Yeah. My religion is a very integral part of who I am as a person. Uh, I am first and foremost a follower of Jesus Christ. And I strive each and every day to learn more about him and try and identify ways that I can align my life more so with the example that he set for us to live. Uh, I spent 2 years serving him and serving in a missionary capacity for my church up in the great state of Montana, actually. I got moved around all over the place and had the opportunity to leave my cell phone at home and have no access or communication to all of my friends or even my family outside of a few phone calls a year and written letters for 2 years, and devoted myself to studying the gospel and sharing Christ and his teachings and his love with as many people as I could. And as many people as that affected within my service, the most I'm excited about is myself. I've changed and become a different person because of that. And as I've now gotten married and had kids, I've tried to make that the center of my marriage, the center of how I parent and how I go about and help other people. Recently, I've been asked within my church community to teach actually a class to high school freshmen every morning before school. We call it seminary, and it's such a unique thing because you take these 14-year-old kids who are just going into high school, just experiencing what it's like to have just that little bit more freedom to take that next step in their life. And they're choosing to wake up an hour earlier than they would, to show up to church and have a Christ centered lesson to get their day started on the right foot. And I've been asked to be the one to teach for some of those students. It has been such an honor, honestly, to be able to work with the youth. And as much as we jest and joke that so many youth are glued to their phones and they don't have interpersonal skills, and you have all these different things going around, the youth of today, some of the most incredible people I've met in my entire life, they're making decisions that I would have probably never made. They they are devoting themselves in ways that just come so naturally to them that took me so much more effort and time and mistakes than took them. And I just could not be more privileged than to get to work with these youth, and to also start my day off with the Savior and in the scriptures and talking about the things that mean the most to me. Because yes, I love health and nutrition and exercise and all of that. And I could talk about that for hours. But at the end of the day, the one thing that matters the absolute most is the thing that I get to spend my time on every single morning. And that has been one of the great blessings of my life, is getting that opportunity to work with those kids, but to also get to spend the time to make these lessons for them, to interact with them, and to learn from them as well.
What a blessing for everybody involved, man. That's amazing. I'm glad that you do that. And it's encouraging to me. And it's also encouraging to me what you said about the youth as well. There seems to be, because of the pervasive culture, more hunger in those younger now. Because I think they can somehow sense that like the gray, boring nothingness, the lack of morality, the lack of anything real anymore in the culture. Like they sense that in a way where they're just going like, oh, I guess we're going over here, and they're like going to Christ. So I'm super excited about that myself as well.
Yeah.
Dude, this has been an amazing conversation. I really appreciate you coming on and sharing everything you have. Where can people find you if they want to have a conversation with you?
Yeah. So you can find me on LinkedIn. I'm probably posting this myself. Uh, and you can email me as well at chris.w@reperiohealth.com.
Cool. We'll put that in the show notes as well. Find Chris on LinkedIn, which is where we connected. And yeah, we'll be back here for the next episode. Before you know it, Chris, thank you again so much, man.
Kurt, it was a pleasure. It's a great time, man.